Hi everybody, my name is David Stocker. I'm a physical therapist for Advocate Aurora Healthcare, and I'm also a Marquette University physical therapy graduate from 2017. Currently, I work as an outpatient physical therapist at a location at a clinic near Miller Park Way. When I began at Marquette in 2011, my chosen major was biomedical sciences. A lot of pre-physical therapy students chose exercise physiology or athletic training as their major. I chose biomedical sciences because at that time I wasn't sure if I wanted to pursue a physical therapy profession or go the route of physician assistant profession. Around my sophomore year of college, I ended up deciding to stick with physical therapy, and I'm very grateful because that fits my personality well and I'm really happy in my chosen profession. But I just want to kind of discuss a couple factors that led me more towards the PT route. The biggest one is that as a physical therapist, you can meet and see and treat your patients 1, 2, 3 times a week for several weeks or sometimes even several months at a time. That allows you to kind of build a relationship, a personal relationship with your patients, get to know a little bit more about them, what they like, what they don't like, get to know about their families, and kind of build that personal relationship with them where, as a physician assistant or as even just a straight physician, typically you're seeing a patient at best, once or twice or, once every couple months, but you're not really getting that time to kind of get to know the patient and build that relationship with them. Another thing I like about physical therapy is it does allow me a little bit more autonomy. In my profession, a physician assistant practices, under a physician. And while I respect that profession incredibly and they are a very valuable member of the healthcare team, I am glad that I chose physical therapy for my particular personality and what I wanted to provide to the world in my profession. Just to briefly kind of discuss what my day typically looks like at this outpatient clinic, I see about 8 to 12 patients a day in 45-minute slots. My role as a physical therapist is to kind of identify a possible diagnosis of patients, but most importantly, kind of identify functional limitations that they have, such as difficulty sitting from standing or pain in their knee going up and down the stairs or anything else along those lines. And after kind of identifying those limitations, come up with a goal and a plan for these patients with their input, and come up with kind of some exercises and activities and education that can kind of help them meet that goal and return to the safest possible lifestyle that they can have. One of the great things about physical therapy is there are so many different fields within this profession or settings within the profession you can go to. There's outpatient, there's neurologic rehab, there's inpatient. There's just so many different ways, and you graduate as a generalist. So if you're interested in that, kind of pursuing more of the different areas of PT, I'd recommend go to apta.org, and that will kind of help you research more different opportunities within this field. If you have any other questions or would like to discuss this, please feel free to shoot me an email at david.stocker, that's Stocker, at aah.org, and I'll be happy to answer any other questions you might have. But I hope all of you are staying safe in this time and you find a profession that fits your personality well. Have a great day.